you somebody who's been struggling with low back pain due to disc degeneration or sciatic nerve entrapment? Check out this video. So today we're going to talk about Cherise. She's 52 years old, came in with bilateral low back symptoms, and she is a overnight nurse and a massage therapist. Cherise started with bilateral low back pain, mainly on the right side. Standing for about 10 minutes, whether it's cooking or washing the dishes, she had an 8 out of 10 stab in her low back. After Cherise's exam, we have found that she does have some low back disc degeneration. So we tested kneeling hip extension because during the exam, she was at on the right side, 875, and on the left side, she was at 9. When we tested her treatments on visit 4, her kneeling hip extension on the left was at 1050, and the hip extension on the right was at 13 inches. So it sounds like right now when she woke up was like a hip symptom. So I'm gonna check her hip capsule over here, and I'm gonna check the right side nerve and any nerves on top because you just want to check all the structures, especially.
That's exactly where it is when you touch it.
Yeah. Okay, so we might check the superior gluteal nerve first. So right now, I am treating her right superior gluteal nerves because she had that local symptom when she did the quadruped lumbar extension. I have done the belly a few times already, so I'm trying new structures to maximize her low back relief. And that's why I checked the gluteal nerves on the right side because the right is our priority, and I found decent amount of adhesion. So while I'm treating the gluteal nerves, they're going like this on the back, going up. So I'm going against it like this, and as she goes to hip extension, I'm maintaining my tension while it goes past my fingers like that.
I don't feel anything.
Okay, good. Line your side one more time, facing the same way. After we did that pass, we retested QLE, the quadruped lumbar extension, and she had no symptoms after. My hypothesis was correct. I am feeling to go deep into the hip capsule, which doesn't really want me in there. So as I continue to treat Cherise, I am looking for more tissues that feel irritated. So I'm looking for the local tissue. So then I meet the glute med with the TFL, and it felt really stuck there. Because that was really stuck, I wasn't able to get into her hip capsule. So I treated that first. I did 2 passes at the side nerve at the external rotators. The tissue softened, which is a good sign for me. And then I moved to the priority of her right low back. So I go right back into the psoas. So I go back into her psoas, treating for the low back. To me, just being a good provider, honestly. Like, if your patient comes in with this one problem, you want to make sure you're doing the tissues around it, but also going back to the chief complaint, the main problem. So if she's standing a lot, all this is going to be working. So if I just clear it out so the tissue can function better, she's able to stand longer. And I found the femoral nerve at the psoas at L4 was bad, but I found a worse spot at the anterior hypogastric, and that was a moderate to severe. She is guiding me where she had that pain in the front. When she placed my hands, I close my eyes and I tap into my body, and I'm like, okay, I'm feeling for the nerves, and that's when I felt the anterior hypogastric nerve entrapment. What's fun about treating the anterior hypogastric is that it goes horizontal versus vertical with the other nerves. So I'm kind of scooping under and pulling back towards me when he's bringing the leg back, and I'm just maintaining my tension coming back behind me so I make sure the nerve starts to floss properly and less adhesion.